school. So I'm actually almost done. I got one more year. I'm excited. So the way I got into pharmacy and how I wanted to be a pharmacist is a little bit non-traditional. I didn't know what I wanted to do, but I knew I wanted to be in healthcare. And I didn't even know what a pharmacist was. I know that one of my friends actually said that they were going to Purdue for pharmacy school. And I was like, pharmacy school? What's a pharmacist? So I actually read up on what a pharmacist was. I did some research and I was like, this is what I want to do because like many of a lot of pharmacists you will ask, they don't like bodily fluids. And I really don't either. So that's why I wanted to, but also because I wanted something to where I was following patients along their treatment. And I really wanted something that was more, I can sit and have a conversation with the patient. Not that doctors or anyone else doesn't, but pharmacists typically do have conversations with them. And then I started looking at where like I can go to school to be a pharmacist. So I was looking around Indiana because I knew I didn't have the funds, or I knew I also didn't want to be out of state. And I found that there was Purdue. And I was like, unfortunately, due to my circumstances and just how life is, I couldn't go visit Purdue. So I actually just applied and I got accepted. And I was like, you know what? I'm just going to go with it because it seems pretty cool. And I do not regret it whatsoever. I thoroughly love Purdue and the campus. And even not visiting it, I made the right decision.
Thanks, Bree.
Hi guys, my name is Sydney Deno and I'm from Mount Vernon, Indiana, which is the very southwest tip of Indiana. And I'm a PP1, so I'm almost on the exact opposite spectrum from Bree. So I'm just a freshman and I'm in my first year of pre-pharmacy here at Purdue. And then, oh my gosh, I'm losing track of all the things I'm supposed to say. So why I chose pharmacy, big thing is exactly what Bree said. I want to be in healthcare. I want to help people, but blood and guts are not my deal. I couldn't be a doctor because I don't want to have to deal with that every day, but I still, I want to help people and I want to be involved in healthcare and be involved in their treatment and things like that. And I've also really loved chemistry, which is a big part of pharmacy, especially going through schooling. So that I guess it all kind of came together. I don't even remember how I found pharmacy. I know a few pharmacists, I guess. Maybe that's how. I don't really remember. And then why I chose Purdue. So I'm from Southern Indiana. Like Bree, I was like, what Indiana schools have pharmacy? And there's pretty much two choices, and Purdue and Butler. And if you look at where Purdue's ranked compared to Butler, Purdue is so much higher ranked in so many different ways. And it just logically it made sense. So then I did get to come for a visit. I sneaked in right before COVID and it felt right. It was the first school I visited, and I went and visited a couple other schools and just nothing could compare. I like the structure, I like the style of the program, and everybody I met was so nice. And yeah, you'll find that at a lot of college campuses, but Purdue was just, top notch. So that's why I chose Purdue.
Awesome. Thank you both. I appreciate that. I think it's always helpful to kind of hear everybody's story and kind of hear their why. So both of you mentioned about why you chose pharmacy. And I think it's so interesting to hear because I hear it over and over and over again. Typically, the type of person that is drawn to pharmacy tends to have these qualities like Bree and Sydney mentioned. They aren't a big fan of blood and guts and bodily fluids. They want to be in healthcare. They want to help people. Don't necessarily want to be in school for another 10, 15 years. Don't want necessarily that 2 a.m. emergency phone call. Pharmacy is very clean. Of all of the areas in healthcare, you don't even really have to touch people all that often and be a pharmacist. So it really is attractive to a student that is very interested in healthcare, wants to have that doctorate degree, have that prestige, be a leader in their community, be a doctor, but not go through the schooling and blood and guts that a physician would. So it really is a nice combination of all of those things. And then the really cool thing, I think, is at Purdue, you get your doctorate degree in 6 years. And you are then out in the world making change, making a difference, and helping those that need your help. So it really is just a very cool niche within the healthcare field. So at Purdue, we have, or in the College of Pharmacy, we have 2 majors. One, we call it BSPS. It stands for a Bachelor of Science in Pharmaceutical Sciences. It is our 4-year degree. This is going to be a broad generalization, but typically, if you are the person that you want to discover the cure for cancer or the cure for Alzheimer's, you want to take a current drug and make it work better, make it work faster, make it less expensive, less painful. It's really focused on drug discovery and drug development, and it really tends to be a little more research-based. That's our 4-year degree. Then we also have a 6-year degree, which is the PharmD. That's what Sydney and Bree were talking about. That is 2 years of pre-pharmacy coursework. You apply to pharmacy school, much like you would apply to medical school, dental school, law school. 4 years of pharmacy school, and then you would graduate in 6 years with your PharmD. In terms of coursework, it's very similar to BSPS. Students are learning the medicinal chemistry, the anatomy and physiology. How does a drug work in the body? Why does it do what it does? But the added component for the PharmD is you're also getting that patient counseling experience. So as a pharmacist, you have a level of knowledge up here, and you need to be able to explain to someone who does not have that level of knowledge the importance of completing your medication, the importance of dosing and side effects and all of those. So I don't mean to imply that if you pursue PharmD, you will never do research, or if you pursue BSPS, you will never work with patients. That is not the case. But those are kind of the main differences between the curriculum of those 2 programs. Kayla, I see you just joined us. So I'm going to have, we have another student with us. So Kayla, if I could ask you to introduce yourself, name, hometown, year in school, and then talk a little bit about how you got interested in pharmacy and how you chose Purdue.
Okay. Hi, I apologize for being late, but my name is
No problem.
I'm from Denver, Colorado, and I am a PP1, so a freshman. And how I got introduced to the pharmacy world and how I kind of chose Purdue for pharmacy. I don't know if this is a very typical answer, but it's a very clean, very sterile specialty, and I did like going down the med track, but I was just not a big fan of all the blood and guts and all that stuff. So pharmacy kind of just found its way to me, and I chose Purdue for pharmacy more specifically from my visit here. It was a lot more. I got a really good feel of what it really meant to be part of pharmacy, and everything was very clear, especially from like the tours that I took. My guide was actually part of the College of Pharmacy, so she really explained everything to me. So yeah.
Awesome. Thank you. It's so funny that you said that. Right before you jumped on, I was talking about how clean pharmacy is. I swear I did not tell her to say that. Okay, so if I could ask you guys, and we'll just keep going in the same order, Bree, Sydney, Kayla, if you guys could talk a little bit about what you think you want to do with your degree when you graduate. I get that we've got 2 freshmen on here, and your plans are probably going to change 20 times, and that is just fine. But today, what areas within pharmacy interest you?
So mine's a little more, I kind of know what I want to do now, just as the years have gone by. So the really cool thing about Purdue is I know we'll get into this later, but during your 4th year, you can apply to do what we call a track program, which kind of prepares you for postgraduate training, kind of like a residency, like a doctor would do. And I know I really want to do that. And I was thankful to get a track program at a hospital that I've always wanted to work at. So I was really excited about that. And so I know that I want to do a postgraduate residency, but I also really want to be both a clinical and a what we call an ambulatory care pharmacist, which is more working in an outpatient setting where you really get to talk to patients and follow their treatment. It's a little more specific in what kind of medications you would be seeing depending on what type of disease state you are treating. So like what disease or disorder they have. It could be diabetes, it could be heart failure, blood pressure, all of that stuff. So I'm kind of leaning more to both working in an outpatient and a more clinical, which is like in the hospital type setting. And that's what I really want to do if you ask me right now.
It's funny that you say that because, I mean, granted, I'm a freshman, but ambulatory care is also what I am really interested in just because it's a really interesting combination of kind of your community pharmacy, you're talking to patients all day long and dealing with them, but also your clinical side of things, where you're not just filling prescriptions all day long. So I guess that's where I'm at right now. I'm also taking my test in 2 weeks to become certified as a pharmacy tech. So I can kind of figure out what community pharmacy is specifically all about. That way I can kind of narrow it down. So I guess I would probably say I'm stuck between ambulatory and community right now. Those are my top two.
For me, I'm gonna go based off like the experiences that I've had so far as a freshman. I don't have like a ton of experience, but I was able to shadow a pharmacist who works at it was kind of a mix of a community and a private pharmacy. It was a very specialized pharmacy through Genoa Healthcare, and they kind of deal with patients dealing with addiction, with mental health issues and all that stuff, which was really interesting to me. So having that community aspect, but also being very specific was something that really interested me. So kind of the community route is where I'm at right now.
Nice. So if I were to ask anyone here, picture a pharmacist, what do you picture? Anybody just unmute and tell me, what's the first vision that comes to your head? Anyone?
I picture my mom. She's a critical care pharmacist.
Okay. Okay. Anyone else?
I picture like a guy in a white coat behind a counter.
Yeah. So Erin, unfortunately, you have exposure to the different types of pharmacy that most people aren't aware of, which is great because you understand that there's so much more than community pharmacy. And Alex, I think you're exactly right. That is the most common picture when you say picture a pharmacist. I always ask this question and I always get somebody in a white coat behind a counter at CVS or Walgreens or something like that. And yes, that is the most common career path. And it is so essential. And we have seen so much change in community pharmacy. Community pharmacists are now doing immunizations and vaccinations. They are doing testing. Those things used to have to be done at a doctor's office or at urgent care. Pharmacists are now so accessible and they are doing all of those things. And COVID has especially taught us how important a pharmacist is. But like Erin pointed out, there are hundreds of other options outside of community pharmacy that I think students just aren't aware of. And like Bree had said earlier, I didn't even really know what a pharmacist did. And I think that's actually really common to not know how many options are available in terms of a career. There is a class that you take your first semester at Purdue called Pharm 100. And it's an intro orientation class, but they bring in guest speakers to share a little bit about their career path so that you get a better idea of all the options that are available to you. So for example, they might bring in a nuclear pharmacist, and that pharmacist will talk about what is a typical day like? How did they get involved and interested in pharmacy? What is their favorite thing about being a nuclear pharmacist? What's their least favorite thing? some advice and suggestions. And then maybe they'll bring in like a research scientist who will talk about what is a typical day like? How did they get interested? What's their favorite thing, least favorite thing? So that you can learn about different career paths for both BSPS and PharmD, so that by the end of your first semester, you feel a little bit better about, okay, now I think I know that this makes a little more sense for me. So especially for those students that are maybe on the fence about BSPS versus PharmD, the curriculum for those two programs is almost exactly the same for the first 2 years. So if you really think, gosh, I love research, but I also want to work with patients, I don't know, you can keep the door to both open for those first 2 years while you're taking classes. You don't need to close a door or make a decision at all while you're still kind of researching and figuring it out. If I could ask the students, will you talk a little bit about maybe what your favorite class is right now and maybe your most challenging class?
Can I say a favorite class from last semester? Because I don't have
Sure.
any.
Yeah, it doesn't have, yeah, of all time.
Oh, of all time. Oh, okay. So there's actually, so my favorite class will have to be when you get into pharmacy school, you have to take what we call a pharmacy skills lab, but I think they call it PLS now. And in that class, they teach you everything. Like this, like you can learn the drugs in one class, but this class teaches you how to be a pharmacist. It teaches you hand-on skills, how to counsel patients, how to write up notes, progress notes, all of that for patients. It just teaches you all the fundamental and basic building blocks of being a pharmacist, and they make it fun. They make it engaging, interacting, and the professors that teach this lab are very nice, and they love the students, and that's why it's definitely one of my favorite class. You have them every semester once you're in pharmacy school, so you get to learn new things every semester. It's so exciting, and that's why I like it. My most challenging class, so I actually like have two. The one that I would say that was hard, that is like one and done, like the most difficult class ever, was pharmacokinetics, just because I'm not super strong in math, and sometimes things don't make sense in my head, and that's why it was difficult for me, but for others it may not be difficult. But as through pharmacy school, you take a class called, we call it therapeutics, but it's called pharmacotherapy. That class is interesting and also one of my favorites, but it's also one of my most challenging because you have multiple different semesters, like every other, either every other day, every other week. You have new professors, new teaching styles, different study habits you have to do to learn the material. But it's definitely the most interesting because you learn about all the medications, all the disease states, and like how the medications work. So it's just like, it's a little bit of everything, you know. We all have our favorites and we all have things that challenge us, but they make us who we are.
So Bree, in your lab class, is that where you guys do the geriatric game?
Yes, it is.
Will you talk a little bit about that? I love that.
So I can't remember. I don't remember when we did the geriatric game. It's been so long. So basically sometimes our labs, we do what's called collaborative teamwork with other healthcare professional students. So like nursing students, speech and language pathology students, and nutrition students. So I think it's either in your P1 or your P2 year, you do the geriatric game lab, where you're paired with paired with a nursing student. I'm pretty sure I had a nursing student, and the professors have different stations that challenge you, because a lot of times when you're working in a community pharmacy or even the hospital, you have a lot of geriatric patients, which is, you know, older people, and they all have disabilities, whether it's they walk with a cane, they can't see because they have cataracts, and sometimes they don't know the medical jargon that we tend to to learn. So they set up these stations where you have these like ailments, like walking with a cane, you can't see, or people are disputing medical terms that you haven't learned about, and you're like, what's going on, to make you really like immerse in what it's like to be a geriatric. And it was really fun and very interactive. And that's what I meant about the skills lab, is they do these things so that you really understand.
Yeah, thank you. I appreciate that.
Obviously I haven't taken a whole lot of classes yet, but by far my most favorite class I've taken is organic chemistry, and I'm in it right now. I'm just taking the first semester and I absolutely love it. I've always loved chemistry, and everybody says, oh, organic chemistry, so hard, it's so hard. And that's true, it is challenging, but it's, I don't know, it's the first class that I've taken that I've really seen like, oh my gosh, I'm really going to be using this kind of stuff. I mean, anatomy and physiology is also really helpful, but I'm very science chemistry brain, so I enjoy studying for it, and I enjoy going to class 3 times a week. And it's a small class and it's only pharmacy students. So that's another thing I love about it. And the professors are so nice, and the lab coordinators and the TAs, and just everybody's awesome. I mean, I haven't met a single person in charge of that class that I have not liked or anything. And just having a small class is also nice, because in your first couple years, you will have a a number of your classes will be large, and you're going to have people in your classes from nursing and, pre-med and all kinds of stuff all together. And there's going to be a lot of you. So this is the first time it was really just dumbed down to pharmacy kids. So I really liked that. And then by far my most challenging class for me is physics, because I'm not a physics brain. It's not how my brain works. So it's challenging for me just because that's not something that I enjoy. So I have to put a lot of extra work into it to get out of it. But it's a 1 semester and done thing. I just have to get through it.
Okay, so Sydney described the kids who are like, oh, organic chemistry is so hard. I am one of those kids. It's a really fun class. I agree. It's just because I don't have that much exposure to it. It's something that I have to work hard to try to understand, but it's still very fun, and I do enjoy that class, and I enjoy attending those lectures and the labs. I think my favorite class, I haven't really taken that many, but Chem 129, which is it's basically general chem in 1 semester. I think I liked it because I had a really good professor, Professor Lindham. She was really good. She was very clear about all the material. It's not like it was super brand new to me or anything, but it was just nice to have a very clear and concise refresher. And it also taught me how to study, because I don't know about you guys, but in high school, like I didn't learn to study. I studied to get a good grade, but I didn't really know how to study. So having a class that was decently, like, not super hard, but it wasn't like a breeze, just to learn good study habits was really fun for me.
Good. Thank you, guys. So Bree talked a little bit about therapeutics. And like she said, it's one of the main classes of pharmacy school. It's like the meat and potatoes of pharmacy school. You take it every semester during starting the second semester of your P1, so your first professional year. And the way we teach therapeutics is actually really unique. And that's one of the things that sets Purdue apart from other pharmacy schools. So the way it's set up, it's a 6-credit class, and you learn throughout your time all of the different disease states. And part of the class, you are in a lecture, and a medicinal chemist, for example, will explain, let's say the topic is asthma. So they're going to explain, how do the lungs work? What happens when you use an inhaler? Why does an inhaler work? How does it work? And you learn the physiology and all of that. But then you immediately go to a lab, which is what Bree was talking about, where you then take what you learned in lecture and learn how to talk to a patient about it. So we bring in community members, we bring in actors to pretend to have asthma. We bring in kids And these pharmacy students have to learn how to talk to a child about the importance of their using their inhaler. That kid very well might start crying. That's a very real life scenario, and you are learning how to do that. So that seamless classroom to lab is unique. The majority of pharmacy schools don't do it seamlessly like that. They'll do a lecture one semester, and then maybe the following semester will be a lab where you practice. So the fact that we do it back to back and make it very seamless is pretty unique. The majority of pharmacy schools do not offer that. Another thing that I feel like sets Purdue apart is we offer a certificate in nuclear pharmacy. That we are one of only 3 or 4 pharmacy schools that offer a certificate in nuclear pharmacy. Bree, did you pursue that? Are you, no? Okay. So nuclear pharmacy is a specialty area of pharmacy where if you have to go in as a patient to get any type of scan, so a PET scan, oftentimes you've heard of somebody who had to maybe drink something or get injected with something that will then light up the infected areas in your body. A nuclear pharmacist compounded that drink or that injection. So it is working with radioactive materials. It is very safe. It is a very small amount of radioactivity, but a nuclear pharmacist is working with half-life, working with radioactivity to make these injectables or these drinkables. So, and when I was talking earlier about how you don't even really have to touch people in some areas of pharmacy, a nuclear pharmacist, you do not have to touch people. You're working in a lab, often kind of weird hours, because if a patient has a 9 o'clock appointment, but the lab is 2 hours away and that nuclear pharmacist is working with half-lives, you've got to be kind of working backwards. Okay, their appointment's at 9, which means they need to drink it at 8, which means I need to get it to the lab by 7. And so they're probably working maybe like midnight to 10 a.m. kind of a thing. So if you're not a big people person, that's a great path for you, but still in pharmacy. So that is a very unique thing that Purdue offers. It is a series of 5 classes that you take during your professional years. At the end of that coursework, you then are eligible to sit for the certification exam. And if you never work as a nuclear pharmacist, okay, but you've got that certification in your back pocket. There's no additional fee to take those classes while you're at Purdue, but it is an extra skill set and an extra certification that the majority of your peers will not have. So it's a really cool opportunity. And I encourage all of my students to take at least the first class in that series to just get an idea of, is this something I would even be interested in? Because again, no additional cost. If 10 years down into your career, you decide, you know, I feel like I need a change, and that nuclear pharmacy thing, that sounds kind of cool. If you were to do that 10 years later, it would be thousands of dollars, hundreds of hours to go back and do it when you could do it while you're at Purdue during your time in pharmacy school. And then lastly, I know I'm doing a lot of talking. Lastly, the other thing that I feel sets Purdue apart is we have a retail pharmacy on our campus in our pharmacy building. Not a lot of pharmacy schools are able to offer that to their students. That pharmacy is open to staff, students, faculty, and the community. During students' P1 year, so their first year in pharmacy school, they take a class where they have to work in that pharmacy for the entire semester. So you learn kind of the back of the house. You learn about medication safety and how do you read a prescription and how do you fill a prescription. Then you also learn the front of the house. So how do I talk to a patient? How do I talk to a doctor's office? How do I talk to an insurance office? And all of that is taught to you in a pretty low stakes environment because you've got older students mentoring you, you've got an instructor there. So if you think, oh my gosh, I'm going to say this wrong, that's okay. There's somebody there helping you. It is a teaching pharmacy specifically for that reason. Bree, do you want to talk a little, we call it PUP, Purdue University Pharmacy. Bree, do you want to talk a little bit about your pup experience?
So I can offer a little bit of insight because like halfway through COVID came.
Yeah.
And so I didn't get to finish the whole time through it. So pup, you have a professor. His name is Alan Farkas, not Dr. Farkas because he's not a doctor, but he is a pharmacist. So it's just kind of confusing, but he's really funny and a great guy. In there, you work in the first section, you work in the pharmacy. So you have different stations where you learn the process of working in a pharmacy. So that's either, you don't type in the prescription, but you see it, you make the label, you fill it, and then you package it, and then Mr. Farkas gives you you will have to give him a rundown of what this medication is. So at the same time if you're learning the process, you're also learning the most common drugs you see in a pharmacy. We call those the top 100 most common drugs. So you give the rundown, what is this medication? What is it used for? What are some major side effects? Those are typically the three things you really like. He makes you give a rundown on. It's very quick. He's very nice. He grades you on it, but it's not a big deal. And then there's another section, like Miss Pedley had said, was that you counsel patients on the medication. So you typically either have a TA or you have a fourth year student with you that will help guide you. They teach you because there's usually a template of how you counsel it that you typically use throughout your whole years in pharmacy school. So like, can I talk to you about this medication? What is this medication used for? What did the doctor tell you to expect from this medication? So it's really just teaching you to really dip your toes in and how to get comfortable talking to people you may not know, or people that are your friends, or, your classmates and stuff like that. And then you have a second section, which is called like a recitation, which is basically just another class, kind of like a lab, but kind of not, where you guys all come together and he goes over like laws in the pharmacy, like in Indiana, like how to give receive a prescription over the phone, or how to transfer a prescription, quizzes over the top 100 drugs. So you learn about it. So you learn the generic, the brand, the strength, the dosage form. So basically, is it a capsule, liquid, or injectable? And then what it's used for, and some like pearls, we call them. So like, oh, this one may cause like coughing or something like that. So that's typically what PUP is like, and it's a very great class. I wish mine didn't get cut short, but that's about as much as I could give on it. But I really like the class, and it really gets you, it's really that push to get you comfortable with talking to people outside of lab.
Yeah, good. Thank you, Brittany. And the nice thing is you do not have to have any previous experience in a pharmacy to be a competitive applicant to our pharmacy school. And I know Sydney mentioned that she is going to have that experience, which is amazing. It's going to be great for her to write about in her essay, to talk about in her interview. It's going to give her some great networking, but it is not a requirement. You do not have to have ever even walked into a pharmacy to be a competitive candidate. We do want you to do some shadowing, and that might be in a community pharmacy, but I don't want you to feel like, oh my gosh, I have to have all this experience to be a competitive candidate, because you do not. Can I ask the panel of students, will you talk a little bit about what you guys do for fun? Like, I feel like it's been so heavy, like, oh, these classes are hard and you've got to do all these things. I swear our students have fun too. So will you guys talk a little bit about, like, what clubs are you involved in? What do you like to do on campus?
So when I was a PP1, just like Caitlin and Sydney, I was involved in BGR, which was like kind of like the freshman orientation committee. So I really like that. I got involved with PUDM and pre-pharmacy club. Now that I'm in pharmacy school, my clubs are only pharmacy clubs. So I'm involved with PPA. I'm actually an officer for PPA. which is I'm a representative for the Pharmacy Student Council. So I get a lot of experiences from there. And then I'm also the treasurer for the Pediatric Pharmacy Done by Students Club, which is just a pediatric pharmacy club. And then I'm also part of APHA and the subcommittees of I forgot what the name was. It's the women's health one. So I really like that. So when I'm not involved with those, some of the fun things that I like to do, as you can see here, my kitty. I love hanging out with my cats. I have another one downstairs, but she just sleeps all day, you know. But I also really like watching TV. I've really been into anime lately. I finished Naruto, both the original and Shippuden, and now I'm watching Boruto, but I haven't caught up on it just because school gets in the way. But that's really what I like to do.
Nice. Thanks, Bree.
I'm also in a couple clubs, so I guess I'll start with clubs and then what I do for fun. I got really involved with PUDM. I know Bree mentioned that, and I'm actually already an officer this semester. Well, it's kind of, there's a whole chain. It's PUDM is really large. It stands for Purdue University Dance Marathon. So that has to do with, if any of you guys in your high school have Riley Dance Marathons, this is the collegiate version of that. So we raise money for Riley, do all kinds of events throughout the year, throughout the summer. It's super fun, and I've already made so many friends through that. And I guess that's my one big like non-pharmacy related function that I am involved with. And then to be here, I'm involved in PPA, which is Purdue Pharmacy Ambassadors. And then I'm in the pre-pharmacy club, which is just kind of, it gives me resources for, oh, we're having a study session for organic chemistry. Oh, we're gonna do some service events. And it's a pretty fun, laid back club. I really enjoy it. And then, so those are, I guess, my three like main things. And I'm also in the honors college. So I'm in a club through the honors college through a scholarship that I won. So that's pretty fun. And then I guess outside of school, I'm involved with Special Olympics, and I have been since I was in 5th grade. So that's it. I was involved in my county, and then I'm already involved up here. You know, I was helping with the polar plunge a couple weekends ago, things like that. I don't even consider that a club. That's more of a hobby. I love Special Olympics. It's definitely a passion of mine. And then I like to just go outside. I like to read. I like to play with my dog. I also have a cat at home. He's at home though. He's not here at school. Things like that. Yeah. Chill with my friends. I have a really big family, so we'll have get-togethers now and then, and we can't get together in anybody's house because there's too many of us now. But yeah.
Nice. Thanks.
Okay, so for me, also to be here, I'm part of PPA, which is Purdue Pharmacy Ambassadors, but my big non-pharmacy club that I'm involved with is PFA, which is Purdue Filipino Association, because I'm Filipino. We actually have our PCN, so Philippine Culture Night, coming up, which is something that I'm very excited for. So I do spend a lot of time with that, just getting involved in all the events they have going on. And leisurely, I do like to read also. I've been teaching my friends how to crochet, and I've been helping my friend with her small business where I actually taught her how to crochet. So she's been doing some stuff and donating her money to charity. So I've been helping out with that. And then I also longboard. I've picked it up quite recently, so it's been pretty fun. Yeah.
Nice. So I saw a question in the chat, and I know Pam was able to answer it, but I wanted to just go a little bit more in depth on it because we don't have any BSPS students on our panel. But the question was, what is a common path after completing the BSPS? And I would say there's probably two of the most common paths. One would be that students use the 4-year BSPS degree as a stepping stone to medical school, dental school, PT, OT, optometry, like really any of those professional programs. Almost all of those pre-health prerequisite classes are built into that major. So with not a lot of thought, you can complete the BSPS and be prepared to go on to most commonly medical school. And actually, I was speaking to a med school rep and was asking about like when they see a Purdue BSPS students, what do they think? And they shared that the most common major for students applying to med school is biology. And I was like, well, that makes sense. It's very common. So he was saying when he sees a non-biology major, that always kind of makes his ears perk up a little bit, because with literally thousands of applications to med school and they're flipping through biology, pharmacy, that's interesting. And so when you're trying to stand out in thousands of applications, having a unique major is one way to do that. So pharmacy prepares students very well for med school. And specifically, we have been told that our curriculum, which requires immunology and biochem and microbiology, which are not common prereqs, are really helpful on the MCAT. So it's a great prep for that. The other path is students will use their BSPS degree to work in a research lab, to work as a pharmaceutical sales rep, or to work in clinical trials. Now, if you wanted to run your own clinical trial or run your own research lab, you really would need to go on and get some additional schooling, like a master's or a PhD. So that is pretty common to see our students going back to school for additional years after the BSPS. But those are kind of the two main tracks that we see with our BSPS.
Ms. Headley?
Yes.
I also want to say that we have a lot of students, especially in my class, that do get BSPS and their PharmD as well.
Yes, that is a very good point. So the curriculums are so similar. I don't want to say it's easy to do, but it is an optional path that students could take if they wanted to kind of combine that research, drug discovery, drug development component and marry that with the PharmD. So it really, again, makes you just a little bit more marketable in the real world. Did any of you or are any of you doing learning community? No? Okay. Let me talk a little bit about the learning community. So the learning community for pharmacy is an optional housing choice that you can live in the same res hall, the same floor as other students in your major. So our curriculum is pretty lockstep in that the majority of students are taking the exact same classes their freshman year. Maybe a slight difference if students have some AP or dual credit that gets them out of a class or two, but typically most students are following a very similar curriculum. So living in a learning community, you are surrounded by people that you instantly have a friend to walk to class with, an instant study buddy or homework pal to do your classwork outside of school. An interesting story that I heard was you get to know the people on your floor because you're all studying together, you're all walking to class together. So there was I don't know, let's say biology exam at 7:30 in the morning, and everybody decided, let's meet in the lobby at 7 and we're all gonna walk together. So it's 7 o'clock and they're looking around, and because everybody knows everybody, they were like, well, wait, where's Susie? She slept through her alarm, but because they knew her and knew, gosh, she's not gonna wanna miss this, they went up and woke her up. And so because of the learning community, she did not miss her exam. So it's things like that that are a really cool option. The flip side of that would be a lot of times students say, you know what, I am going to be surrounded by pharmacy students for years. I really want some non-pharmacy friends. And that is just fine too. It's a optional housing opportunity and perfect fit for some people, not a great fit for others. So just wanted to make sure you guys were aware of that as well. Any of you doing research? Or Bree, have you done research?
No, I wanted to. Oh, sorry. I know.
That's okay.
I wanted to. It's hard because I commute to school, so I can't do something that's you would have to show up every day for.
Yeah.
And I'm really
Yeah.
hoping on my rotations for my track program, the lady said that residents do their research around the fall. So she said that I could help out with that. So I'm hoping to do that.
Good.
But I know a lot of my classmates, they do research as with professors that we've have had.
Yeah, so Purdue is considered an R1 research institution. That is the highest level of research that a university can offer. And because of that, we strongly encourage students to get involved in research if that's an area of interest to them as early as their freshman year. And I think a lot of times students think, oh my gosh, I've never been in a lab. I've never even dealt with a test tube or a beaker. Who is going to want me in their lab? And actually, research instructors love students that have no experience, because then you don't have any bad habits from another lab that they have to break. So every student, whether you've got 10 years of experience or 0 experience, you have to go through training in that particular lab. So they are going to teach you everything that you need to know. There is nothing wrong with having 0 experience. And you might get in the lab and go, this is amazing, and end up doing research for your 4 or 6 years that you're here. You might get into the lab and go, this is not for me. But now you know, you do it for a semester, looks great on a resume, interesting thing to talk about in an interview, but you don't have to commit to anything beyond a semester. So another really cool opportunity that Purdue offers its students. We've got just a few minutes left. Let me ask the students to maybe finish with piece of advice, words of wisdom, and especially Kayla and Sydney, since you're just so closely removed from high school, maybe something that you wish that you knew, or something that you think will help as the audience is kind of making their decisions about not only just college, but also about a major.
Did you want me to say one?
Yes, please.
So my piece of advice is, if I would tell myself, is it's okay to get an F and not an A or B, because I don't know if any of you want to hear this, but you're probably going to fail a test once or twice. I don't know. I can't tell you how many times, but I'm still here. I'm still progressing, and it's okay. It's okay, because we can't be perfect all the time. And college is something that you really have to step out of your comfort zone and really get comfortable with. And sometimes that takes people months or years to get comfortable with, and that's okay, because grades do not define this. And just because sometimes some people are better learners with learning material and others are better hands-on, you'll notice that when you go on rotation, some people that are getting A's on tests are like, oh no, what's going on? I feel like I don't know anything. And then you get the people that do poorly on tests and they get hands-on and they're like, wow, I really know my stuff, but why wasn't I doing good on tests? Sometimes some people are just different learners, and just grades do not define you, and do not let it get you down.
Definitely, second that for sure. And one thing that honestly I wish I would have known coming into college is that everybody, well, I guess almost everybody, there's always those few people that can just jump in with 2 feet, but everybody is in a new spot. Everybody's trying to figure it out. They're trying to, stand on their 2 feet, figure out what college is all about, and get settled in their classes and trying to meet new people. I came here and I know 2 people that are here right now, and they live in a learning community, so I see them never because they're engineering kids. And so, I'm pretty much stranded. I'm 4 hours from home. I don't know anybody, and I'm a pretty extroverted person. I would consider myself extroverted. But I really struggled, especially that first week. I'm here and my roommate's an education major, so it's not like I see her anywhere either. And it was hard, and I felt like I was constantly, talking to people that I was never going to see again. But you just have to not be afraid to put yourself out there. And the first week is probably going to be socially exhausting. Just don't be afraid to talk to anybody and everybody, because you never know who you're going to meet. You never know who you're going to talk to. I was talking to Dean Barker, the dean of the College of Pharmacy, and I didn't even realize it initially. So you never know who you're going to meet, who you're going to talk to. So just don't be afraid to put your best foot forward. And yeah, grades don't define you. Purdue College of Pharmacy looks at so many other things. I'm surprised we didn't get to the puzzle pieces, but they look at so many things, and GPA is just a piece of that. So don't let it become your whole puzzle, because it's not meant to be. And good luck, and I hope you choose Purdue.
I also definitely agree with the grades aren't everything speech. For me, my biggest piece of advice is just to be present. Be like, school's hard and school's still going to be hard, and college is, you're definitely still trying to figure things out. But figuring things out is all part of it. Like, you're never going to be a college kid anymore. Like, you can go back to college, but you won't be a college kid. So just enjoy it while you can. Make friends where you want to make friends. Don't make friends where you don't want to make friends. Go to the events that you think might be stupid, but you might actually have a lot of fun. Ask the stupid questions, because who knows, maybe they'll give you an answer that you didn't think of. So I mean, at the end of the day, you're working through life trying to get your degree, so don't take it too seriously.
Nice. So I heard two of you mention the puzzle pieces. So what they're referring to is, and you can Google this, it's all over our website, the components of the PharmD application. But basically what our admissions committee is looking for is it is truly a holistic review of all of the candidates that apply to pharmacy school. Yes, GPA is important. Yes, it matters that you do well academically in pharmacy school. But I would say it's also really important to have leadership skills, to be able to communicate. You can be the smartest person in the room, but if you can't talk to your patients, if you can't talk to your colleagues, if you can't be a leader in your community, I don't know that a pharmacy degree is the right fit for you. So we look at just about, if you think about everything that you have to do to be a competitive candidate for Purdue, those are the same things that our admissions committee is looking for to be a competitive candidate for pharmacy school, with the addition of shadowing. So we really want to see that you've kind of spent a day in the life of what a pharmacist does and what a pharmacist is, that you can speak intelligently about your future career. But they're also looking at leadership. They are looking at community service and volunteer work. They're looking at your essay and your letters of recommendation. They're looking at your work experience, and that work experience does not have to be pharmacy related. They really just want to see, have you held a job? Do you understand that somebody else is relying on you, that you need to show up on time and be responsible? Those are the things that they're looking at. And not one, like Sydney mentioned, not one of those puzzle pieces is bigger than the other. And that's for a reason, because they're all equally important. Every year we have students with a 4.0 that do not get into pharmacy school because they thought, I've got a 4.0. I don't need to do that leadership stuff, right? Yeah, you do. And on the flip side of that, we have students with a 2.9 that do get in because they knocked it out of the park in all of the other areas. So it really, like Bree said, we do not expect perfection. We want to see that you are a well-rounded student. And if you do have a weakness in one area, okay, fix it with, like, kind of make up for that weakness by having a strength in another area. So that's just a brief overview of kind of the admissions process. I always am a little hesitant talking about the admissions process to PharmD because you're still thinking about, like, I don't know if all of you are seniors or not, but if you've been admitted, like, you just got through that process, and I don't want to throw another competitive process at you, though I do know it is very important and things that you do want to be thinking about. I've seen several questions in the chat. Is there anything else that you wanted the students to answer or talk about before we wrap up? Any questions that anybody wants to answer? Or I'm sorry, ask.
Hi, yeah, I have a question. So for like timing, kind of, what are hours like? Like if I was to pursue like a PharmD career, or just attend the school, like what are the hours like specifically?
Andre, can you say a little bit more about that? Like, are you asking how much time do students spend in class?
Yeah, and like in your certain labs and all those things.
Sure, any of you can take that question.
Are you asking more specifically like for the PharmD or?
PharmD, yep.
Okay, so our classes are typically longer once you get into the professional program. So therapeutics is about 2 to 2.5 hours. I can't remember, 4 times a week. The lab is about 3 hours, and other classes range from either 2 hours to 1 hour. But the thing is, it's kind of hard to explain because when you're a P1, you go for all 16 weeks in a semester. And then once you hit P2 year, you only go for 12 weeks. So your semester is cut off by 4 weeks. So that time is going by really fast. And the timing of the class is not like the length of the time, but the times, like what time you have therapeutics, what time you have lab, what time you have this is all different when you're a P1, P2 versus P3, and then P4 year, you're not even in a class. So you only have 3 years of that didactic, which is like the classroom learning. Does that make sense? Did that answer your question? And then
yeah,
it
that
also
works.
just like depends on like what electives you pick and stuff. Those can be anywhere. I took like a nutrition class that was all online that I didn't even need to go to class for, and then I did one where it was, 1 hour to 1.5 hours watching movies for weather and stuff like that. So it all depends on what electives, but all your classes are already like kind of preset, basically.
Yeah, and just
Thank
to
you.
add to that, Andre, to explain what she was saying. So a 16-week is a typical college semester. Your P2 and P3 year, they purposely shorten it to 12 weeks because then those 4 weeks that you're not in class, you are doing it's called a rotation. So you're doing like an on-the-job training, and you will spend a month working for free in a pharmacy to learn about community pharmacy. You'll do a rotation in a hospital to learn about that type of pharmacy. So it's on the job training. And then your final year of pharmacy school is 9 month-long rotations where some you get to pick, some you have to do. And we find all of those for you. You don't have to go out and scramble to find these rotations. We find them, we set it all up. We even offer some international rotations. So we have a rotation in Kenya. We have a rotation in Colombia. We have a rotation in London. I know this isn't international, but we have a rotation in Alaska. I think there's some on some Indian reservations in Arizona. So some really cool opportunities if you wanted to travel during your P4 year, or you stick around your hometown and do it that way too.
Sounds good. Thank you.
Yeah. Any other questions?
In your last few years of pharmacy school, what kind of like fields can you specialize in? Can you go into like OR pharmacy or outpatient?
So absolutely. Surprisingly that you mentioned the OR. So in my track program, I actually have a rotation in the operating room. So there was so many that I didn't even notice that there was. Me, I kind of typically stayed around where I live because I live in the region, so Northwest Indiana. So there's some, like she said, some in Indian reservations. There's some international. I have the one through my track program, the operating room, in different types of critical care, because you said your mother was a critical care. I have a NICU and a cardiothoracic ICU rotation, solid organ transplant. You got the different types of retail. I think it was Caitlin, she had said Genoa Healthcare, which is more so specializing. There's compounding, retail and infusion clinics, long-term care facilities. There's so many rotations that you can take and different opportunities like that. When you're doing your IPPEs, which is the one she said that the time allotted for those rotations, you don't really have that much flexibility of choose. You do choose where you go, but as in like operating room and stuff like that, you can't do that because you're just trying to get to learn the pharmacy. But once you're in that 4th year, you can choose those awesome like rotations like that.
I know it is past time, so if you all need to jump off, we totally understand. But we also want to stick around to answer any questions that you may have that did not get answered. If there are no other questions, I want to say thank you, thank you, thank you. I am sure that there were a million things that you guys could have done tonight, and joining us to learn a little bit more about Purdue and a little bit more about pharmacy is amazing. So I truly appreciate your time. I'm going to put my email in the chat. So if you have any follow-up questions, if your parents have questions, if you want to set up a visit, if you want to set up another call, happy to do any and all of those things. So please reach out to me and let me know how I can be helpful. And I can also connect you to, like Bree just did, I am happy to connect you to a current student, because I know it's always really helpful to get their take, their perspective, hear their advice, because they're currently in it. So if you want me to get you connected to a student, I'm happy to do that too. Thank you all so much. I appreciate your time and attention tonight.
Thank you.
Thank you.
Caitlin, I actually have a rotation at Genoa.
Oh, cool.
Up here by me. So when you said that and you said it was like specialized, because I was so, I'm not a retail person, no offense, but you know, I'm just not. And when I saw that like all my electives were retail, I was very upset. And I saw Genoa and I didn't even know what it was. And then you told me that, I was like, all right, this is gonna be awesome.
Yeah, it was pretty fun. I got connected through a friend back home's dad went to pharmacy school with one of the pharmacists there. So he was able to get me in, and I got to shadow him, which was pretty
That's
cool.
awesome. Are you guys liking PP? I'm sorry, Miss Pedley.
No, you're fine. You're
Are you
fine.
guys liking PP 1 year?
Yeah. I don't really know what else to say, but yeah, other than physics.
She's like, physics. We don't talk about physics. I took that at a different school. Physics is not my friend. My brain doesn't think that way. But when you said you liked organic chemistry, I got flashbacks. Because it's just no. My brain doesn't work that way. The little chair confirmations, I couldn't. I saw I was in the library the other day and I saw one of those little the little structure things, the bag.
Yeah, the
on the
model
table, and I
kit.
was like, oh my gosh, is this my nightmare coming back for me?
Thank you all so much. I appreciate you giving up an hour of your night. It means a lot to those students, so I really appreciate it.
Thanks, Miss
I
Pedley.
remember being
Thank
one
you.
not too long
I
ago.
know, Sydney, I do remember. Good night, y'all.
Good night.
Bye.
Thank you. Good night.